Well, it's 7:01, and why don't we get started? Good evening, and welcome to this Smilow Cancer Hospital and Yale Cancer Center Patient and Family Forum. I'm Dr. Charles Fuchs, and I'm the Physician-in-Chief of Smilow Cancer Hospital and the Director of the Yale Cancer Center. And I know I speak for all of my colleagues that we're so grateful that you've taken the time this evening to join us for this special forum really addressing our response to the COVID-19 pandemic. I'm joined this evening rather, by several of my outstanding colleagues at Smilow and Yale, and I'll call your names and perhaps you can just wave so everybody knows who you are. So starting with Dr. Kevin Billingsley, our Chief Medical Officer at Smilow Cancer Hospital and an internationally recognized leader in surgical oncology. Dr. Sarah McGallion, Deputy Chief Ambulatory Officer and a medical oncologist in our breast program. Dr. Laurie Santos, Professor of Psychology at Yale University and Head of Silliman College, who is a leader in the science of wellness. Bonnie Indek, Manager of Oncology Social Work at Smilow Cancer Hospital. Kara Henderson, a Senior Nurse and Patient Service Manager at Smilow Cancer Hospital. And Kylie Cook, Nursing Professional Development Specialist at Smilow Cancer Hospital. Last month, for some of you may know, we began these special forums to keep you updated on our continuous efforts to address the challenge of the COVID-19 pandemic. And in really the past now 6 weeks, you may have noticed a number of important changes. For instance, moving both our inpatient and outpatient locations across our cancer center, consolidating some of the practices across the region, developing new protocols of how we see patients and how we deliver care, moving to telemedicine in terms of engaging our patients, how we communicate with you and care for you. And all of these things and more have been motivated on the fundamental principles to, first and foremost, continue to provide compassionate, expert, state-of-the-art care to our patients across our 16 Smilow sites in Connecticut and Rhode Island, and no less importantly, ensure the safety and well-being of our patients and our staff. Tonight's speakers and panelists will be reviewing those approaches with you as well as answering your questions. With respect to tonight's agenda, which I'll bring up, following my introductory remarks, we'll be hearing from Drs. Billingsley and McGallion about some of these changes. We realize that the well-being and health of our patients and families is vitally important, particularly during this crisis. And we were so pleased to have Dr. Santos join us to speak about that, given her expertise. And then lastly, we'll be turning to your questions and joined by Kara and Bonnie and Kylie and Kevin and Sarah and myself to answer those questions along with Dr. Santos. But I want to just, again, cover some critical points that you're certainly familiar with. This is a highly infectious virus that presents, as you know, with fever and respiratory symptoms, cough, trouble breathing, muscle aches, fatigue, or malaise. And one prodrome that often occurs early on is a loss of taste or smell, things to be aware of. Key questions are, what can you do to protect yourself? You know this. Practice good hand washing. Stay at home, critically important. And if you have to go out, limit to the essentials, or better yet, use delivery services, or if you're a cancer patient, have your family or friends help you get those things. Avoid close contact. That is, keep your distance, your physical distance 6 feet or greater. Certainly avoid contact with individuals who may be ill or carrying the virus, even if they're in your own household. And monitor your health at home and watch for these symptoms, including taking your temperature twice a day and watching for trouble with cough or trouble breathing. What should you do if you're concerned you have these symptoms or you're concerned about the contact in general? Is call your physician, your healthcare provider, your healthcare facility. But do that before visiting. What we don't encourage you to do is show up in an emergency room, because we're available for you 24/7. So call us as well. There is a COVID-19 hotline through the health system. You can see the numbers here, and we'll be available for you at any time. So these are the important things to bear in mind. You've recently heard about recent recommendations to wear a mask. That's fine, but that shouldn't mitigate the need for physical distancing and to do all the other important things. And to keep that up, even though we're doing this for a while, don't give up on those important steps. Let me turn now to Dr. Billingsley and Dr. McGallion to share with you some of the details of our work here at Smilow. Kevin, I think you're muted.
Yes, I am. Now I hope folks can hear me. Thank you, Charlie. To start with, I just want to take a minute to underscore a couple of key principles. One is that our primary aim is to continue to care for all of our patients and their families as safely as possible, to manage them and care for them through the continuity of their cancer care journey, and do everything we can to keep them safe from this additional threat of COVID-19. So safety number one, and then continued uninterrupted access to cancer care services, and moreover, the cancer care providers that our patients are used to seeing. In response to this pandemic, we've had to make a number of changes that both myself and Dr. McGallion will describe to continue to provide service and access. But in spite of these changes, one of the things that we are really prioritizing is that patients want to see the physicians, advanced practice providers, and nurses that are their anchors and their source of strength, consistency, and continuity through these challenging times. And those have really been our guiding principles as we make adjustments to our system. Next slide, please. So we have had to relocate a number of our ambulatory oncology practices. And by ambulatory, what I mean is outpatient care, including clinic and our infusion services. So those services that are characteristically provided on the first floor of the North Pavilion in the Smilow Hospital have been relocated to the Guilford Care Center. For any of you who have not been to Guilford, we also call it Shoreline. It's a beautiful facility. It's located on Goose Lane, right off the interstate. The access is fabulous. The parking is good. We have great space, both to care for our patients in clinic and follow-up, as well as really very nice infusion spaces with a lot of privacy, as well as accessibility and openness. For patients who have been historically seen on North Pavilion 4th floor and 8th floor, we have relocated those services to our North Haven Care Center. Again, North Haven, for families and patients who have not been there, is an outstanding 4-floor facility that is conveniently located. There's a wonderful ground floor reception area, and all of our teams are located in continuity with providers, advanced practice providers, and nurses, all in close proximity in pods. And I just toured this facility on Monday and was so impressed at how our teams have come together to recreate their care units in a new space over a very short period of time. Our patients who are seen and cared for by the head and neck surgeons in our group, that service has been relocated to our Trumbull Care Center. As many people know, head and neck care requires a sophisticated set of chairs, equipment, and endoscopes and otoscopes that we don't have in all of our centers, but we are very well equipped in Trumbull. And again, that care center is a really spectacular facility, and we're providing uninterrupted care there. For head and neck patients, cancer patients who are not seeing the surgeons but are seeing medical oncologists, they have moved right across the street from the Smilow Cancer Hospital to the phase 1 clinical trial space in the Park Avenue building. So I'm going to just quickly reiterate, in spite of lots of moving pieces, you will find, if you have not been into these new centers, that you'll be seeing the same physicians, be greeted by the same nurses and administrative people, and it will feel comfortable and familiar. I will note that for those folks who are cared for in the hematology service, that's hematology and bone marrow transplant, for a number of reasons, we have prioritized keeping those services at the Smilow Cancer Hospital. So there are no changes there. That's NP7 and 11. Next slide, please. So one of the services that we have opened under the guidance of a number of our superb nurses, including Lisa Barbarotta and Kim Slusser, is something called the Smilow Rapid Evaluation Clinic. And what we understand is that many of our patients will have symptoms, including fever, cough, and these symptoms can be non-specific but concerning for a COVID-19 infection. And we do not want folks, as Dr. Fuchs said, coming to either an urgent care center or an emergency room, particularly if they're receiving cancer treatment or have recently completed treatment. So we have created a very specialized clinic that allows folks to come in and have rapid COVID-19 testing. Within 2 hours, the test result will return. And once we have that result in hand, we can make decisions about your care and decide whether you need to be in the hospital or you can safely go home. Next slide, please. Over the past couple of weeks, we have seen at least several patients every day through this clinic, and we've seen 34 patients. Fortunately, the majority of the people we have seen in this space have been COVID negative. We have identified 4 patients who did have COVID infection, and they were treated appropriately. As you can see in the right, some patients were admitted. One of the infected patients was admitted, and most patients are discharged back to home after management of their symptoms. Even a couple of the patients with infection were discharged to home, and some people who require more urgent care were sent to the emergency department. So I think with that, I'm going to ask for the next slide and ask Dr. Magallian to kind of bring us up to speed on our many efforts in telehealth.
Well, thank you very much, Kevin. It's a pleasure to speak to you all tonight. My name is Sarah Mugalian. I am, as Charlie said earlier, a breast medical oncologist and a member of the ambulatory operations team at Smilow. And what I'd like to talk to you about is telehealth and how we have incorporated telehealth into the delivery of cancer care. So the first question might be, well, what exactly is telehealth? And I think a simple definition is it's the use of technology to connect you with your provider, to share information, to receive follow-up care. It's essentially a platform for you to continue to be closely connected to the people that provide you with medical and cancer care while maintaining distance. And telehealth allows you to share your information remotely, securely, from the comfort of your own home. Also, an added perk, it does save some time. It eliminates travel and waiting. The graph on the right that I put into this slide just shows you how quickly we've ramped up our capabilities over the last few weeks. Back at the beginning of March, we were doing virtually no telehealth visits. And over the past few weeks, we're now in the thousands of video and telephone routine follow-up visits with our patients across the cancer system. Next slide. Although telehealth does incorporate both video and telephone visits, A video visit is probably the best way to do a telehealth visit. It allows you to see your provider and to communicate not just by voice, but also by facial expressions. And we can learn a lot just from seeing you on the screen. You don't need too much to have a video visit. You need a smartphone or a tablet, either an Apple or an Android platform is fine. You do need a MyChart account. You need a MyChart login and password, and you need the app downloaded onto your smartphone and tablet. It sounds a little bit complicated, and some folks do have some difficulty, so we're actually working on a program to call you the day before your visit to make sure that you have all the appropriate downloads, that you have the appropriate access, and that you're all set up for your video visit the following day. If you're interested in a video visit, you can call your doctor's office and request that one be set up. I should also say that there have been a lot of lessons learned over the last couple of weeks, and with those lessons, we've really tried to improve the experience for everyone. So if you had a bad experience early on, I urge you to give it another try. Next slide. I did want to make sure you had all of the information you needed for any troubleshooting that you might need. If you need help getting a MyChart account, if you need help with your existing MyChart account, you can't remember how to get back online, or if you need help preparing for a telehealth visit, you can visit our website at yalecancercenter.org/telehealth. All right, next slide. Next slide. Yeah, thank you. And then finally, I did want to just highlight that we do have a central website that's incorporating all of our information with regard to this COVID crisis available at www.yalecancercenter.org/COVID. And what this page is continually being updated. It includes information on support groups, on online virtual integrative medicine events, on the location changes and directions to those various locations, other telehealth issues that you can get there all from this central page. So this is a wonderful resource that you can easily access if you need to. And I think we'll be making these both these slides and these web pages available via social media after this meeting. I think that's all that I prepared.
Terrific. Thank you, Kevin and Sarah. And for those people, as you have questions, you can certainly submit them on the chat button. If you're on Zoom, you can also send them to canceranswers@yale.edu, and we'll try to answer them during this forum and also after that. So I want to now turn it over to our next speaker, and really very fortunate to have Professor Laurie Santos joining us. For those of you who may be familiar, Dr. Santos, beyond being a professor of psychology and the head of Yale Silliman College, she really is an expert in the science of wellness, and her work has been cited in a number of forums. Her course at Yale, entitled Psychology and the Good Life, has become the most popular course in Yale's history, and approximately 1/4 of all Yale's undergraduates have enrolled. In September of 2019, she launched a podcast for which she's the host called The Happiness Lab. And we've actually been able to partner with Dr. Santos throughout our organization, really to look at the well-being of our staff. And we thought it was critically important as well to share Dr. Santos's insights with our patients and families, particularly in this difficult time. So Dr. Santos, thank you for joining us.
And thanks so much for having me. It's fantastic to be able to share these tips both with the healthcare providers who are working so hard to keep everyone healthy during this scary time, but also the patients and their families who I know are going through a different kind of crisis in the midst of COVID-19 in terms of their mental health. And so what I wanted to do today was just to start by validating the fact that this is an incredibly scary time, and it's worth kind of taking a moment to realize this. I mean, we're in the midst of an unprecedented pandemic that's incredibly scary. There's tremendous uncertainty about how long it's going to last. And that's true for all of us around there, but it's even worse if you're facing, a cancer diagnosis, or if you're kind of fighting through your process of fighting cancer. All of these things make it incredibly worse. And so The good news, though, is that despite the scariness of the situation and despite the uncertainty, there's lots that the science suggests we can do to control our mindset in the context of this situation. We can actually do something to protect our mental health during this time. And we can do that by controlling the mindsets that we take to this situation, as I'll talk about in a second. But there's also different behaviors that we can engage in that tend to protect our mental health during this scary time. And these are all going to be evidence-based practices that you can use to protect your mental health. And I think knowing these tips is really critical right now. I think one of the frustrations of this uncertain time in COVID-19 is that we want to know what to be able to do. And I think we know what we should be able to do to protect our physical health, right? You just heard the wonderful tips that were shared here. You got to wash your hands and socially distance and just stay home. But we often worry about the things we can do to protect our mental health. We want similar evidence-based interventions that we can engage in to make sure we're not as anxious and we're not as uncertain and so on. And that's what I'm going to provide you here with today really quickly, is just a couple tips that we know can really improve our mental health during this time from the perspective of science. And I'll try to get through 5 tips. We'll see how fast we go. But the first of the tips I wanted to share with you all is that research suggests that social distancing doesn't necessarily mean social isolation. And this is really critical. Every available survey of people who are in positive mental health suggests that people who are really happy also tend to be really social. They tend to spend more time with other people, and they tend to prioritize time with the people that they care about. Problem, of course, in COVID-19 is that if you want to copy these behaviors of happy people, it's a little trickier because we are supposed to be socially distancing, which is especially important if you have a recent cancer diagnosis and you're in a more vulnerable category. The good news is that there are ways to curb this loneliness despite the fact that we might be socially alone. And we need to do this in part because that's what we do best in a crisis. In fact, the thing that builds resilience most in the context of a crisis is the act of coming together with other people. The good news is we have technologies that allow us to do that virtually. I mean, we're doing that right now. Hundreds of individuals from Smilow are getting together through this Zoom window. And that's very good to kind of have this support that we can through these technologies. But one of the things we need to make sure is that we're using technologies to mimic the informal interactions that we have too. And we all kind of know how we can use these technologies to have a sort of work meeting or a sort of formal situation like this. But we also should be using things like Skype and Zoom to, chat with our neighbors while we're chopping up our vegetables, or do a quick Zoom yoga class with a friend. Like all the simple informal interactions you have with the people in your neighborhood, try to find ways to mimic those through these types of virtual technologies. And if you're the kind of person who's not into the sort of Zoom virtual technology and you're feeling like this is a little tech heavy for you, then just pick up the phone and connect with someone. It sounds really simple, but these kinds of social connection activities right now are essential for the resilience we need to get through this virus. And there's also some evidence that these kinds of things can help our immune function as well. And so making sure you're staying socially connected can be really, really powerful. That's sort of tip number 1. Tip number 2 is that even though we think this is an emotional time and we kind of want to shut off all our emotions, this is a time when we should be engaging our positive emotions even more. So positive emotions like gratitude, like joy, like compassion, these things are incredibly important in the current time. And I wanted to sort of dive in for the second tip and focus on just one of these emotions, which can be incredibly powerful, which is the emotion of compassion. And so compassion, we don't often think about compassion when we list our emotions, but it's the feeling that we get when we really want to go out there and help someone, when we want to become other-oriented. And the research really suggests that the power of kind of marshaling compassion can be incredibly important for our well-being. There's lots of research suggesting that, self-care, kind of focusing on yourself and being really self-focused isn't really the key to happiness. Happy people tend to be relatively other-oriented, and that means they want to do things to help other people, often by engaging in their emotions really closely. And so the good news is that there are lots of ways that you can cultivate your own compassion. One of the great ways to do this is through different kinds of meditation practices. One is known as loving kindness meditation, where instead of just kind of meditating and following your breath, you take a moment to sort of think about the people you care about most and wish them well. So you literally can just kind of close your eyes and, stream in your head the people that you care about most, your family members, your care providers, anyone who's touched you and been around in your life. You can just sit there and wish them well. May they be happy, may they be safe. The research suggests that the act of doing this can really build up our positive emotions. But even more importantly, this is the kind of practice that can really reduce burnout. And I feel like this is particularly important for those of us who aren't just facing a cancer diagnosis, but might be family members who are caring for those in cancer diagnoses, or even healthcare workers who are thinking about these things. The act of kind of taking care of somebody who's really suffering can be really difficult, but compassion is an emotion that you can cultivate to get through that even more resiliently, and with even more happiness and positive emotion. So that's tip number 2, is that we should be making room for these positive emotions, especially compassion. Tip number 3 is another really powerful one that I've been using a lot lately, which is that in this time where we're feeling so panicked and so anxious, it's incredibly helpful if we can take some time to calm down our sympathetic nervous system. What's our sympathetic nervous system? Well, you might remember from your old biology classes, this is the fight or flight system. This is the system that's in your body so that if there's a tiger and you have to run away really quickly, you can harness your muscles and get out of there as quickly as possible. The problem is that when we're facing a chronic threat like COVID-19, that fight or flight system, which is only supposed to come on for a few seconds, is actually on chronically. And that can lead to all kinds of inflammation. It can hurt our digestive function. It's just generally not good for us to be running that system on high alert, which many of us are doing all the time. So if you're experiencing a little tension in your chest, if you're kind of experiencing a sort of panic and sort of muscle aches at the fear of this virus, that's probably your fight or flight system activating. The good news is that we have some physical control over that system. One thing we can just do is to actually harness our breath, which ends up turning on a different part of our autonomic nervous system, the parasympathetic nervous system. That's the rest and digest system that wants to kind of turn back the regular functions of our body on and stop worrying about the threat. You can activate your own parasympathetic nervous system just through your breath. So if you've ever been kind of upset and somebody told you, just calm down and take a deep breath, it turns out they were kind of paying attention to your deep biology, because the act of trying to take a deep breath, especially a really deep breath that goes through your belly, it can activate the parasympathetic nervous system through the vagus nerve. Basically what it does is it convinces your mind, like, hang on, we wouldn't be breathing this deeply if there was a tiger around the corner. Everything must be okay. We can kind of chill out now. And so just through the act of, every hour or so, take a moment, every time you hear the chime of a new hour, take a moment just to do a couple really deep belly breaths. Just breathe in deeply and breathe out really slowly. And the act of doing that can really activate this system that's going to help your body rest and digest. It can help your immune function. It can basically put you back on a slightly less panicked track. And so that is top tip number 3, is that we should be taking time to calm our sympathetic nervous system. Tip number 4 is one that I like to call get back to the basics. We know there are lots of things that we tend to do all the time that are good for our physical health, that are also good for our mental health. These are things like making sure we're getting the proper amount of sleep, getting in some exercise if that's possible for you in your physical situation right now, even trying to eat as healthily as possible. These things map onto our physical health. Obviously, they're good for boosting your immune function and keeping you healthy generally, but they're incredibly important for our mental health. We forget. Research suggests that just getting the right amount of sleep can allow you to reduce emotions that are associated with clinical depression. And there's other research suggesting that a half hour of cardio every day can be as effective as like a prescription of Zoloft for reducing depression symptoms. And so in this time when things are a little bit different and we get out of our routine, often the first things to go is our normal exercise routine, if we have one, even just simple walks around, like the kinds of things that you do just to get your body moving a little bit. Those things can go away. And so find some ways to bring those things back, especially even if it's hard for you at this stage to focus on exercise. Definitely try to focus on getting as much sleep as possible. A wonderful mental health and immune booster sleep is. And so that's tip number 4, is we should be finding ways to get back to the basics, the normal healthy things we do to promote our healthy functioning. Those things are going to help our mental health too. The final tip, which I think maybe is the most important, gets back to a specific kind of compassion that I think is really critical right now, which is having a little bit of self-compassion. Crises happen and pandemics come. And one of the saddest things is that rather than just weather that storm, dealing with all the suffering that's out there, often we deal with the suffering by beating ourselves up. We feel like we're not being good enough or we're not doing enough good things. This is true, especially if you have family members at home, like young kids, and you're worried about, being a babysitter and a school teacher and all these things. Like, it's going to be hard for a while. And this is why I started with validating the fact that this is an incredibly tough time normally, and it's going to be an even tougher time if you're dealing with a cancer diagnosis or people you care about are dealing with a cancer diagnosis. And so one of the final pieces of advice is just to not beat yourself up, to allow yourself some compassion. This isn't going to be the time when you're doing your best work. This isn't going to be the time when your family is necessarily at their best, and that is okay. That is what's supposed to happen. No one is expecting anyone to be superhuman through this, and so we just need to give ourselves a bit of a break. And so those are my quick 5 evidence-based tips for the kinds of things you can do to increase your mental health. Happy to answer any other more specific questions about the kinds of challenges you're facing in terms of anxiety or uncertainty. And yeah, I think we can sort of open it up for more questions now.
Well, Laurie, thank you. That's extremely helpful. And we do have a few questions that I'll offer to you first, and then we'll open it up to the panel. Patients are asking what are the resources that they can turn to. In fact, one person asked about the programs that you have that are available. How would you answer that?
Yeah, well, we've done a few things to put as many resources as we can online and available for free. So the class that I teach is called The Science of Wellbeing, and you can find it on Coursera, which is the online platform that gives away lots of free content. It's Coursera, like course, like ERA.org. And if you look for The Science of Wellbeing, you'll find the class there. It's a 6 to 10 week class that can give you all the tips that my students learn in class, the ones that I've talked about and more. And you'll also focus on homework activities that are these practices that we know can boost your well-being. And so the homework is not like write an essay or read some sort of, reading or whatever. The homework is really take time to experience social connection, take time to get more gratitude in your life, and so on. The second resource I'll share is my podcast, which is called The Happiness Lab. It's also like a whole set of tips that you can use to feel better. We're actually doing a whole special series on COVID-19 and how you can best promote your relationships, best reduce anxiety, and so on during this time. And you can download the Happiness Lab wherever you get your podcast. If that's on Apple Podcasts or Spotify, if you just do a search for the Happiness Lab, you should find it. And I think those resources are useful, not just because they're free and they're just available to you, but I think signing up for those resources with a friend or someone else who's going through the same thing that you're doing, they can be wonderful little commitment devices to make sure you stick with listening to the podcast episodes or taking the class down the line.
Fantastic. Thank you. Actually, one of the comments came in that somebody's listening to your podcast and they think they're excellent. And
Thank you. That's good to hear.
Let me ask as well, I think the advice you offer is great. And sometimes what we do hear from patients is they do these things, but then there are days, particularly as you're going through this ordeal for weeks and longer, you just wake up and it's just a bad day, for not necessarily for any particular reason. So, what would you recommend to a person who has that, wakes up in those circumstances?
Yeah, I mean, the first thing I'll say is I can relate, and I'm not currently going through a cancer diagnosis. Like, this is going to be a marathon and not a sprint. And there's a lot of suffering and a lot of uncertainty and a lot of just like messed up routine and just kind of things that are a little bit annoying about this process. And you're not going to be, happy-go-lucky the whole time. Like that would be crazy to assume that anyone would feel that way. It'd be Pollyanna-ish. Like, that's just not what we're dealing with. And think that's where the self-compassion comes in. Like, there's going to be ups and downs, like in any tough process. As those of you who are going through, a cancer situation know quite well, there are highs and there are lows. And that's what's going to be taking place during this pandemic. But I guess the 2 pieces of advice I would give is partly the self-compassion, but then also the power of baby steps. If you can just, get an extra 10 minutes of sleep, or if you're having a bad day and you could just make a phone call to the easiest person you can make a phone call to, like those tiny things that you could do can actually be really powerful for not just boosting a tiny bit of your well-being, but also starting to help you develop positive habits over time. If nothing else, if it's a really bad day and you have this memory, like just stop to take 4 really slow, deep breaths. And even that can kind of just give you a little bit of a reset to your sympathetic nervous system. So it's not always going to be easy. It's not always going to be hard. And you don't have to be, the perfect pupil of happiness all the time. But any tiny thing you can do can make a big difference.
Thank you, Bonnie. I wanted to open, that's a question you probably hear a lot as well in your work as a social worker. Is there anything you wanted to add to that?
I think it's important to feel whatever feelings that you have. to express them, to call a buddy, check in with them, talk about what it is that's going on with you right now, because processing with somebody else is very, very helpful. And if you don't have a buddy to do that with, please reach out. Social work is very much trying to reach patients and calling people to make sure that they're coping as effectively as possible with this. But if by chance we don't get to you, please call us. We are more than happy to be your buddy, to listen to you, to help you process your feelings. If you prefer to do a group, we have a lot of support groups that are happening virtually. As I mentioned last time, the participation is increasing with those support groups. Recently in a caregiver group, we had a family member join us from the Midwest. And before we did groups virtually, that would have never happened. So we're here for you. We want to help you with whatever emotions you might be feeling.
Bonnie, thank you. Professor Santos, I know you are going to have to move on to another meeting, and so I just, before we'll open it up to the other panelists for questions, but was there anything you wanted to add before we let you go?
I guess the final tip will just remember that, again, this is a marathon, not a sprint, which means we need to be patient, but any kinds of things that you can put into effect that can help you right now, those things are going to help you kind of make it through this long sprint, but they're also going to be habits that you can start to put into place ahead of time. And, most of us are going to make it to the other side of this crisis. And hopefully all those habits that we build in now that are helpful for our well-being, those are going to be useful then too. Another wonderful tip that I heard is that, every day we make it through is a day that's closer to the end of this crisis. And so let's enjoy and savor the fact that we're getting closer to it. We don't know when it's going to end, but it will be eventually, and we're getting closer every day. And so that will say bye. Thanks to everyone for having me on board. Nice to see you all.
Thank you. So I'm going to turn to our other panelists for the questions, but before we do that, I wanted to give both Kara and Kylie a chance to share some thoughts. And Kara, let me start with you, and just obviously you both see a lot in the course of your work as nurses. Any thoughts, Kara, that you wanted to open up with?
Sure. Thank you, Dr. Fuchs, for allowing me to address our patients and families. I did see some questions rolling in about surgical cases and patients asking questions about, are we still performing oncologic surgeries? And so I did want to take a minute to talk a little bit about that. So I am the manager for the surgical oncology practice, and I lead like a very dedicated staff of providers who are very committed to our patients and families, especially geared towards recovery after surgery. And in order to prioritize our patient safety during this time, we did develop a special surgical care pathway to meet the needs of our cancer patients during this crisis. So within our Department of Surgical Oncology, we have all different types of patients that are recovering from, an array of different types of procedures. So we combined surgical oncology with the gynecologic oncology patients to keep our postoperative patients cohorted together, and also to keep them with the nursing staff that they're very familiar with and the same physicians. And so even though elective surgeries have been canceled throughout the institution, we are looking at patients with cancer where surgery is the first line treatment option. And so there are surgeries that are continuing to occur in order to provide the best possible outcome for our patients. And I had seen that one of the patients asked about, are we still going to be performing a Whipple? And yes, in cases they're reviewing, if the Whipple is the appropriate surgery, then the patient will still be able to have their surgery. We've worked really closely together with our surgeons to ensure that we have a solid plan for our patients that focuses on safety, but continues to deliver our Smilow care signature, but just in a different physical location, like Dr. Fuchs had mentioned before. So we've moved many of our surgical teams here to the St. Raphael's campus, and we've opened up a surgical oncology unit here to serve our patients just in the same way that we've always done at Smilow Cancer Hospital on the 14th and 15th floor. And all of the frontline staff have relocated in order to care for our patients. And now that we're up and running, we're continuing to care for our postoperative patients with all types of cancer, but just in our centralized location with our expert nurses, our advanced practice providers, and our surgeons.
Great, thank you, Kara. Kylie, any thoughts that you wanted to share?
Sure. So as Dr. Billingsley talked about, we did open the Smilow Rapid Evaluation Clinic just a week ago, or a little over a week ago. So we do take in patients who have symptoms concerning for COVID. We do have access to the rapid tests, and then we make an assessment. We can discharge patients home. We can admit them to oncology floors if they're negative. If they are positive, we'll assess if they can go home with further follow-up or if they should really be admitted to one of our COVID units. And then just today, we actually started implementing daily phone calls to any Smilow patient who has tested positive or has a pending COVID test. So we run a test every day, every morning. We might not have gotten to everyone today because it was our first day, but our goal moving forward is to touch base with any patient who has tested positive or has a pending test, follow up, see how they're feeling, just touch base. If they are positive and they're starting, to have worsening symptoms, we can bring them in and evaluate them and see if we can give them any treatment options or if we should admit them. And any pending results, same thing, we would call and follow up.
Thank you. A number of other questions, and actually some more questions on testing. And I'll start with Dr. Billingsley. For patients who are undergoing chemotherapy or other treatments, what's our stance on testing? Should they be getting testing, and under what circumstances should we be doing things like that?
It's a great question, and I will say that we are continuously evaluating our testing protocols, and one of the things that is happening is that we have increased access to testing, and the testing is getting more rapid, daily, weekly, almost daily. So it really depends on where people are in the course of their treatment. If people have not had exposures and they are asymptomatic and there are no sources of clinical concern, we are not at this point routinely testing everyone. However, we have protocols in place that define very clear groups of patients that we need to take extra precautions around. And those are individuals who may have had an exposure to COVID-19 either at home or at work, or they are coming into our system from a high exposure area. And we have created a set of guidelines to help our nurses and our frontline staff evaluate people who are in those groups. And in general, what we're doing is requiring some testing before the patient comes in to see us. We understand that can be difficult, but that's where our frontline staff is really pitching in and helping out and guiding patients and families to locations where they can get tested and get tested quickly. Obviously, if there are situations where people are having evolving symptoms or they are anxious or frightened, we create strategies and pathways to evaluate them more quickly. And that's where the rapid evaluation clinic that Kylie was describing is so helpful. If someone is at a high risk or they're having symptoms concerning for COVID-19 and they need to be seen, we want to see them as quickly as possible, but see them in an environment that keeps them safe and keeps our other patients in the system as safe as possible.
Thank you. Dr. McGallion, a number of questions that I think you've seen, I know you're answering online as well about telehealth. And you've seen them, but I just wanted for everyone to get an answer. Some questions about if you have a future appointment, let us say in May, how can you move your appointment to telehealth to avoid coming in? And then also questions about people who who actually live outside of the state of Connecticut receive their care at one of our sites in Connecticut? And, you know, can we do telehealth in those circumstances?
These are all really great questions, and yes, I am trying to rapid fire answers to the in the chat there, but I'm thrilled to have the opportunity to share the answers to these questions live. So the first, for upcoming appointments, we are several days to a week ahead scheduling, rescheduling appointments. So as we get closer to your appointment, your provider will decide whether or not a telehealth visit is appropriate for you, and we'll contact you to switch that appointment over. However, if you'd like to make sure that a telehealth visit or a video visit is appropriate and you'd like to get that on the calendar, you can always call your providers and call the clinic, and we'd be happy to switch that over for you. The second question with regards to locations, this is a sticky situation because states govern telehealth themselves. However, New York State currently, we can do telehealth visits, video visits to patients in New York State. That law and that rule is through the end of this week. I expect that it will change. Many things are changing very quickly, so it's honestly very difficult to stay completely on top of all of this. But closer to your appointment, the person that asked this question has an appointment in May. I think closer to that visit, we'll be able to know whether or not we can do a video visit, and we're happy to do it. In fact, we prefer video visits if they're at all possible. Telephone visits, telephone calls can happen regardless of your location. So as long as you have a telephone and your doctor has a telephone, that interaction can still take place.
Thank you.
Mm-hmm.
Bonnie, questions about how we're managing support groups in the era of physical distancing. I use the phrase physical distancing because you, I think, have pointed out we shouldn't call it social distancing. But how are we handling this?
So our support groups are taking place either on Zoom or through conference calls. And as I said before, we have increased participation, and it's really working quite well. And if you don't have a Zoom app, you can certainly call in, even if it's being done on Zoom. People have been very positive with the results. Patients and families are, as I say, very satisfied with managing all their issues on the phone. They feel very much that their needs are getting met. And we're going to continue it. And we might have actually found a new workflow for, going past COVID. So I think this is working out really well. Sometimes you find a few, you can make lemonades out of lemons. And so that's a really good thing.
Thank you. Kylie, I know you were answering this question online as well, but a question about if you think you have the symptoms, how do you contact the rapid evaluation clinic, or is there another way that you should go into the system?
Yeah, so we ask that if you are starting to exhibit symptoms or you think that you might have been exposed, that you call your primary oncologist, and they will then make a call to us to help with crowd control. We're assigning times, so we'll be in contact with your team, and then they'll be back in contact with you.
And on a related note, for folks who are concerned because they think that they had a contact, they're not even sure, maybe they came in contact with somebody who that person came in contact with somebody infected. How do people sort through that?
Sure. The question is,
so the question is that
contact with someone else?
You and any of our panelists can answer. So the question relates to a person actually came in contact with somebody who came in contact who's infected. Do you follow? So a second degree of separation, but you don't know if the person you saw who came in contact with the infected person is putting you at risk. And how do you approach that?
So I think that we would just want to encourage people to continue to self-monitor, to check their temperature twice a day, be aware of the signs and symptoms, to socially distance, wash your hands. And if you do feel like you're developing any symptoms, to then reach out to your provider.
Thank you.
I couldn't agree more. This is a perfect example. When I need a practical answer to a medical question, I find one of the nurses.
Well said. So, another question actually mostly on screening in general. Well, the question, Sarah, is about mammograms, but it really speaks to the broader context of what are we doing about cancer screening approaches in the midst of all this? Should we be canceling those appointments? Should we keep them? What would you suggest?
Yeah, so a lot of cancer screening tests have been postponed. With regards to the breast center, regular annual routine screening mammograms have been postponed. You should receive an automated message or from the radiology group themselves. They're several weeks ahead in terms of rescheduling, moving those studies out several months, I think, at this point. The same is true for screening colonoscopies. Right now, the reason for those delays and that postponement is that the risks of coming in, and just in the not that coming in is an inherently risky procedure, but in the spirit of social distancing, less contact with other people is preferable. And so those screening procedures have been delayed. There was Charlie, if it's okay, I'd like to answer one more question that came up on the chat, which was with regards to getting a reminder about an upcoming visit, specifically in the breast center, specifically in Guilford. And I can say that if your provider feels that a virtual visit is in your best interest, your appointment, we will offer you the opportunity to switch. And if you would prefer not to come in, because even if your provider disagrees, we can certainly work that out and have a phone call to discuss that, or have a video visit to discuss that, because all of these decisions about keeping appointments or keeping studies or canceling appointments are really individual discussions between you and your provider.
Thank you. Let me I'll offer this to Kylie and Kara. Questions about, in their provider is suggesting that there's a need for them to be seen as opposed to doing it by telehealth. Should that person be worried about having to come to a healthcare facility for care?
So I think that we have taken a lot of precautions how patients feel safe when they're coming in and entering the facility. And it starts with the phone calls the day before to do some screening and monitoring to ensure that you're feeling well. And then an additional screening at the door of both the patient, and if they're accompanied by their visitor as their ride, they are temperature checked and then asked a full array of screening questions. And the reason for some of the moves is to allow segregation of patients that may have been infected or are infected. And so we're trying to cohort patients and condense and consolidate to ensure that we're keeping our most vulnerable population safe. So I do think that there are a lot of steps that are taken to help our patients feel safe. And the one thing we don't want are people trying to ride things out at home without contacting any of us, because we're here for you and we can take care of you, and we don't want people waiting till the last minute to come in.
Thank you. Bonnie, as a follow-up question to your earlier point about how do people find out about how these events, these support groups and other things are being scheduled, is there a way to stay abreast of all that?
Sure. So certainly you can look at the Yale Cancer Center or hospital website, and all the information is listed there. If by any chance there's information you need that you don't see, you can always call the Department of Social Work at 688-2195, and we'd be happy to answer it for you. I would also like to get back to your point that you made a few minutes ago about physical versus social distancing. And the reason I say it's physical is we're still social beings. We're still reaching out to each other. We're doing it more than ever, whether it be through Zoom or Skype or phone calls, whatever's happening, church and synagogue services online. We are still very, very social, and that is extremely important to keep up. So while we're calling it social distancing, it's really more physical. It's a sense of isolation, and therefore at times, or it can be a sense of isolation, and therefore at times it makes it more stressful. But remember, there are a lot of people there for you, and all we have to do is reach out and continue with our social beings, and we'll be okay. We will get through this day by day.
Thank you. Kevin, there's been a number of questions about radiologic procedures. That is, are we still doing the imaging studies, MRIs, CAT scans? Are we still doing them? Should patients reschedule them? Should they be concerned about having to undergo them? What would you suggest?
Yeah, a couple of things. Yes, we continue to do indicated radiographic studies. Now, that being said, I'm going to pick up on something that Dr. McGallion said, which is that there is an effort being made to balance the small risks of coming in to a medical facility against the benefits of undergoing procedures, particularly follow-up procedures. So all of our teams are working with patients and their families kind of on a case-by-case basis to make those decisions. For many people who have a follow-up scan, whether it's a CT scan, an MRI, or even mammography or chest X-ray, in some of those cases, we are deferring those studies for some period of time. For people who are having symptoms or need an evaluation, by all means, we are proceeding with those. And I will say that one of the questions I saw go by is how is the equipment in imaging cleaned between patients? And one of the things that we know about this virus is that it is eradicated with alcohol-based products and physical cleaning. So all of the equipment, not just in radiology, but throughout the hospital, is being extensively cleaned and maintained with alcohol-based cleansers. One of the other things that may have been related that I saw go by was about not just radiology, but radiation oncology and what's happening in radiation oncology. And, I think it was a really good question. And I will say that in future panels, I think it will be important for us to have one of the radiation oncology, radiation therapy team on the panel to help answer those questions directly. I will say, like all of our areas, we're being extremely cautious regarding patients coming in to the radiation oncology treatment centers throughout the system. That screening, masks at time of entry. We're watching all of our providers very carefully. We're cleaning all of the linear accelerators and treatment waiting areas very, very carefully between each patient. But as anyone who is receiving ongoing radiation knows, these are treatments that once you start on the treatment pathway, we really don't want to interrupt. You don't want to stop that 5-day-a-week treatment. So we are being very direct about counseling patients who are getting radiation treatments to maintain really disciplined social distancing, and being very careful and really working hard to get people through those treatments. Some of them are 5 weeks long without any interruptions or delays.
Thank you. And we'll take one last question. Kylie, I'll offer this to you. The CDC, other sources are talking about people wearing masks. And I wondered if you have advice about, what people should be doing and when they should be doing it.
Yeah, so as nurses, we are wearing masks in all patient care areas. Same for any provider that's in a direct patient care area. Everyone is required to wear a mask. And patients are also wearing masks, as well as their family member or visitor who comes to give them a ride, who comes to accompany them. And I would say even right down to, out in the atrium, we're told we could wear level 1 masks, which are your cloth masks. People are they're wearing them all the time. Yeah.
And if they're sort of walking out in the street to get some fresh air, what would you recommend?
So we do ask that when they come back in that they put on a clean mask.
Yeah. Well, I know we're out of time. I hope that tonight's forum was able to address many of the questions that you all who joined us had asked, and we want to keep you informed throughout this pandemic. As you know, this cancer center was founded on the fundamental mission of improving patients' lives and discovering the next generation of life-saving cancer therapies. And as you've heard from my colleagues, we are absolutely committed to that, so that throughout this period of time, regardless of the circumstances, our commitment to providing world-class cancer care to each and every patient remains steadfast and without compromise. So I want to thank the speakers and the panelists and all of our staff at Smilow and Yale Cancer Center for what they do every day. And I particularly want to thank all of you tonight for joining us. I know I speak for the more than 2,000 dedicated and talented individuals who work at this cancer center that it is really our great privilege to work with all of you, the courageous patients and families at our center. As you've heard, we are here for you always. So for tonight, as Dr. Santos said, it's 8:03 and we're one day closer to the end of this pandemic. But for now, stay safe, stay strong, and have a good evening. Thank you.